to everyone afterwards. And if you have any questions, please hold those to the end, and we'll have a short, quick Q&A question. If any members of the press would like to record on their own end, please go ahead. That actually makes things easier on myself. And any questions in the chat or any questions, again, please hold to the end. Will, do you want to go ahead and get us started?
Yeah. Ms. Colton said I'm the Communication and Outreach Associate for Smart Approaches to Marijuana based in Alexandria, Virginia. And I was just at the hearing this morning for the legalization and commercialization bill that's being put forth in the Senate. And it's being couched in terms and in phrases as something that will advance social justice goals. And we need to be very clear about what's happening with this current bill that's being proposed. Last year, Virginia decriminalized marijuana. That is an advancement of social justice goals, removing criminal penalties for personal possession. And we have worked as an organization to introduce decriminalization measures in different states. What's happening now, though, is completely different. We're talking about a for-profit industry, and quite frankly, as you're going to hear later, this is a addiction for profit industry. They are posing this as something that is to advance social justice goals, to reinvest in communities harmed by the war on drugs. But when we look at every state that has made these exact same promises, we see that time and time again, they have fallen short. I've just thrown out behind me several headlines that show in state after state after state that it's less than 4% nationally, less than 4% ownership in the industry by people of color. In places like Illinois, which talked very much about their equity initiatives, there's still zero businesses in Chicago that are majority minority owned. And the system has been gamed time and time again by wealthy white entrepreneurs who are taking advantage of legalization and commercialization. And at the end of the day, we have to recognize that that's what this is about and ask ourselves, are we ready for the consequences of an addiction for profit industry proliferating in Virginia? In places like Colorado, we see there's more pot shops than Starbucks and McDonald's combined. And we have to ask ourselves again, is this the type of commercialization? Is this something that's going to be good for public health in Virginia? Is this going to be good for the youth in Virginia? And these are the questions that we have to ask ourselves and not allow a narrative that's being pushed again by a multi-billion-dollar industry. Big Tobacco has invested over $2 billion in the industry. Major alcohol companies have invested hundreds of millions of dollars in this industry. We need to be honest with ourselves and see what's happening here and ask, is this the best way forward for marijuana policy in Virginia? We already passed decriminalization, which deals again with that possession criminalization, and that is a positive route forward. But I submit to you that commercialization and legalization is another extreme on the spectrum of marijuana policy, just like incarceration, and we fully oppose commercialization and legalization in Virginia.
Wonderful. Is Terrell with us from Henry Code Too Smart? Please go ahead.
Yes, I'm here. Hi, I'm Terrell Pollard. I'm the chair of Henry Code Too Smart to Start Coalition. The Henry Code Too Smart Start Coalition opposes recreational marijuana. Just to kind of echo some things that were already said, I commend legislators for being mindful of social justice. I think some of those were achieved, and it's a complicated thing to achieve with criminal decriminalization. I also think that there are some things that have been achieved and can be achieved when it comes to medical marijuana. When you legalize recreational marijuana, you're sending a dangerous message. We always see that, and our focus is youth. We always see youth go up whenever access is increased. Legalizing does that. Whenever the perception of harm decreases, legalizing does that. And I beg of the legislators to review this, because we have been talking about social justice, but we haven't been talking about health. We've been talking about how the disparities of how the law
Terrell, I think we're all having an issue hearing you there.
Suicide with the pandemic. And we have a opioid epidemic that's rising again. And so we are struggling with legal drugs already. So why aren't we talking about what safeguards, guardrails will go on the front end? And so I think we just are premature of legalizing recreational marijuana, and we need to worry about the safeguards. Thank you.
Thank you. Moving on to Octavia Marsh, Executive Director of Hanover Cares.
Good morning, everyone. So Hanover Cares, we primarily focus on youth prevention. And so in regards to marijuana legalization, it simply does not consider or offer enough protections against youth access. And also in states that have legalized, youth access and use have both increased, as well as poison control centers have also reported increased unintentional injuries and exposure to marijuana. Youth also perceive that any substance that is legal is safe, and we all know that legal does not necessarily mean safe. And so even if it's not intentionally marketed toward our youth, they are indirectly exposed and become of this substance. And we also, protective factors are minimized when we make changes to the laws without having specific regards to education or strategies in place to protect our youth in their developing brains, because we know that we're trying to build perception of harm, and we want to keep them from the unintentional consequences of this illicit substance. And so my proposal is that Virginia should identify and also fund evidence-based prevention strategies to protect our youth and work with the prevention coalitions that already exist in the organizations, much like that are here on the call, to ensure that specific considerations are being made for our youth in regard to educational curriculum, community and parenting education, as well as harm reduction and availability and access safeguards. And when we think about other substances, there are already challenges with respect to other substances in the field like alcohol and nicotine-containing products when it comes to youth access. And so we should also continue working toward trying to mitigate youth from using some of those before we're going to try to expose them to a substance like marijuana. And so we should also first just build on the prevention foundation, because as the bills are being proposed, it does not consider public health context regarding social determinants of health, and also the goals of Healthy People 2030, as well as Virginia's own plan for well-being as it relates to health behaviors of drug and alcohol use. And so for that reason, I oppose legalization.
Wonderful. Thank you so much. Moving to Dr. Jonathan Lee.
Hi, good morning, everybody. Thank you for joining us today. I am a board-certified physician in addiction medicine, internal medicine, and psychiatry. As the medical director of the Farley Center, I take care of patients with substance use disorders and co-occurring disorders. I'm currently serving as the immediate past president of the Virginia Society of Addiction Medicine. The American Society of Addiction Medicine warns against cannabis use in youth, adolescents, young adults, persons with a history of mental illness, substance use disorders, as well as persons who are pregnant. ASAM warns about the risk of unintentional overdose of edible cannabis products by children. Driving while impaired from cannabis is associated with an increased risk in motor vehicle accidents. With the rising potency of marijuana and use of high THC concentrates, the National Institute on Drug Abuse reports that marijuana exposure during development can cause long-term and potentially permanent adverse changes in the human brain. Cannabis dependence develops in approximately 10% of regular cannabis users and may be associated with cognitive impairment, poor school or work performance, and psychiatric illnesses, including anxiety, depression with suicidal ideation, and psychosis with paranoia and hallucinations. Therefore, I would oppose legalization of cannabis, marijuana in the Commonwealth of Virginia. Thank you for your time.
Thank you. Next, we're moving to Dr. James Avery.
Good morning. I'm a visiting assistant professor at UVA, co-director of the American Academy of Medical Ethics. I'm triple board certified, fellow in the American College of Physicians, the College of Chest Physicians, and the Academy of Hospice and Palliative Medicine. You know, the seeds for my being here were planted when I was asked to be on a committee exploring marijuana, and the medical studies stunned me. I had never seen a larger gap between the science and the public's perception when it came to the harmful effects of marijuana. For example, you know, marijuana is not safe for those under 25 years of age. The studies are clear. Yet it's become normalized for young people. Neuroscience tells us the younger a person is exposed, the greater the negative impact. You know, the Surgeon General said it emphatically. No amount of marijuana use during adolescence is safe. I mean, look at teen-directed marijuana products when you go to Colorado and California. The reasons are clear. Large corporations want profit. I'm a pulmonologist. This is the exact same playbook that big tobacco did years ago. Hook them when they're young and you get a customer for life. You know, as someone who's worked in emergency rooms, I've taken care of lots of people with car accidents. It's not pretty. There's no question about it. Legalizing marijuana will make our roads less safe. Studies show it impairs every critical skill set associated with driving a car, and we don't have the equivalent of a breathalyzer test. 70% of marijuana users admit to driving when high, and about the same percent said they know they won't get caught. You know, in the 1980s and 90s, when marijuana contained less than 5% THC, I never once, not once, took care of a patient with THC toxicity. Today, my ER colleagues tell me THC poisoning is a daily event in states where marijuana is legal. You know, as a physician, I have seen the havoc alcohol, nicotine, and opioids have had on the health of the poor, minorities, and the disadvantaged. It's going to be the same with marijuana. Don't let corporate profit, don't let politics and tax revenue prevail over science and prevail over the health of the good people in our Commonwealth. Thank you.
Thank you so much. Next is Mary Krauser.
So there I am. Okay, hello everyone. I'm Dr. Mary Crozier. I'm a retired academic with over 40 years experience in substance abuse prevention, intervention, and education. I'm the immediate past chair of Community Coalitions of Virginia, which includes over 50 different community coalitions, national affiliates, organizations, individuals, law enforcement, etc. Okay, we oppose adult use marijuana legalization and decriminalization of youth marijuana use. Evidence-based research shows a number of long and short-term medical, social, familial, occupational, educational, safety risks all from marijuana use. Marijuana risks have been exponentially increased recently due to THC levels, and that's the technology of growing the product. Also, we have increased risk due to the pandemic. Some of marijuana's countless unintended consequences include the pediatric poisonings, child deaths, academic underachievement, and compromises to the workforce. We are also troubled by the recent national survey that shows an increase in adolescent marijuana use during this pandemic, which is exacerbated by inaccessible counseling and treatment resources. Now is not the time to legalize marijuana in Virginia because of the pandemic, because of the economic recession, and the fact that decriminalization has yet to be enacted. Thank you.
Thank you so much. Next, you're going to Regina Whitsitt.
Hi, I'm Regina Whitsitt. I'm Executive Director of SAFE. We're a Substance Abuse Prevention Coalition in Chesterfield County, Virginia. I think that the media has heard enough from prevention advocates on this call, and I really appreciate the comments that were shared by the health experts. And at this time, I would like to defer to either Linda Moore to talk about her personal story, or to law enforcement to talk about what they see in the field. Thank you.
Linda, would you like to go ahead?
Can you hear me?
Yes.
Every time I get ready to speak, I start crying because everything everybody talks about is so personal. But you know, my son at age 21 developed psychosis from smoking pot. He has since been to a 90-day rehab, has come off all of his medication, and is functioning as a normal 22-year-old boy, if there is such a thing. And this has turned our life upside down in many ways. And I just ask that everybody who's not aware of the devastating effects that marijuana can have, to do the research and look at the human being side of what's happening to people in their 20s who are of legal age, who are smoking marijuana, and get the facts straight before they legalize something that's killing our children and causing them harm. Thank you.
Thank you so much. We appreciate you sharing. Anything else to add, Regina?
No, I would defer to law enforcement at this point. Thank you.
Thank you. Next, we're going to go to Mr. Jones of the Virginia Sheriff's Association.
I'm John Jones, representing the Virginia Sheriff's Association. Our association is opposed to legalization of marijuana. And let me talk for a minute about some of the dialogue we've heard over the year relating to social justice and law enforcement and who's incarcerated. We've all heard the term mass incarceration, how much money jails are spending incarcerating people for smoking marijuana. So I had the chance, you know, a few months ago when this was being discussed, to drill down into the jail population of all of our local and regional jails. At that time, we had about 26,000 inmates serving in those local and regional jails. There were seven, you count them on two hands, people incarcerated that were charged with marijuana possession only. So dispel the idea that we, as the citizens and the sheriffs and the taxpayers, are spending a lot of money locking people up for recreational smoking marijuana. It just doesn't happen. The next false narrative that I've heard over the last few months and year during this discussion is that all of the resources that law enforcement is spending on enforcing marijuana. Nothing could be further from the truth. Don't believe us, don't believe law enforcement. Look at the JLOC report that just came out that talks about resources by law enforcement represented about 1/10 of 1% of their time. It hardly puts a dent in what law enforcement is doing. We have so much else going on, and now with COVID, marijuana is not in the forefront of our enforcement efforts at all. And certainly last and certainly not least are the deaths on the highways that we're going to experience when this happens. All you have to do is to look at and pick one state, Washington State. The studies there have shown that fatal crashes involved 8.8% of those people were using THC. The 5-year period before Washington State legalized marijuana. In the 5-year period after Washington State legalized marijuana, the 8.8% jumped to 18%. So you had a doubling of the cases in at least one state where there was THC involved in fatal crashes. So, you know, what does it take to get this message through that people are going to get hurt and they're going to get killed on the highways because of drug driving? And as one of the speakers earlier said, the testing is not there yet. So I'll be happy to answer any questions at the end. Thank you.
Thank you so much. I realize we passed over Dr. David Anderson, so if you'd like to go ahead, sir. Sorry for skipping you there.
No, that's fine. Hi, my name is David Anderson, and I'm Professor Emeritus at George Mason University. My doctoral work 35 years ago was at Virginia Tech in public policy and public administration, so I draw a lot of my comments from that sort of grounding with planned change. I also spent my my childhood and teen years in Virginia and worked at Mason for 3 decades, following 12 years as a college administrator, and sadly had to deal with some drug overdose and traffic safety deaths with students. I've worked professionally with drug and alcohol abuse prevention for 45 years with a focus on youth and young adults. So when considering legislation, I think it's important to have quality data, both quantitative and qualitative, hearing from people with boots on the ground. And about 10 years ago, a colleague and I did a study on teen drinking that I think is quite instructive for the consideration, particularly with youth, because we focused on high school youth. We talked with youth around the nation and into the Commonwealth. And that study really helps give some insights about some of the root causes why young people use drugs or alcohol. And I think that would be very helpful as we think about this. So I'm very, very concerned with any attempts to legalize marijuana at this point. As we've already heard from one of the other individuals, the message of legalization communicates safety. That's what our youth hear. That's what a lot of our general public hears. And there's so much misinformation about marijuana, even using the term recreational, I think is a disservice. Legalization will likely have many unintended consequences. We know what those are. We've heard that today, and we've heard that for decades. We know that from health and general safety and traffic safety. So it's important that we engage our practitioners, our teachers, our principals, our traffic safety personnel, our medical personnel, our health personnel, because they know what the consequences will be. They know what will happen with legalization. So with any legislation, I encourage policymakers and legislators to build on science, be intentional with their efforts, and think this through very, very carefully. With that context, I do oppose strongly legalization in the Commonwealth of Virginia.
Thank you so much. We have 2 more speakers. If we'll go now to Sheriff Mike Chapman.
Good morning. I've been on the front line of law enforcement front lines for over 40 years, 23 of which I served as a Drug Enforcement Administration Special Agent across the globe, and last time serving as the Sheriff of Virginia's largest full-service sheriff's office. I've seen the consequences of drug trade from its production to use, and the lives and families destroyed as a result of the scourge. I've experienced firsthand the issues associated with legalization when serving in Northern California, where THC-related products such as gummy bears or other candy products are produced to entice youngsters to engage in this personally destructive behavior, much like the Joe Camel cigarette ads years ago. And I've seen the legalization has led to in Colorado, where traffic fatalities resulting from drug use now outnumber those related to alcohol. Realize that the bills proposed don't distinguish between THC levels, which range from what was customary in the 1970s and 80s at about 5% to vaping now, which is up to 85 to 90%. There would be no quality control or no way to distinguish legally produced marijuana or illegally produced or legally produced marijuana. Even alcohol and cigarettes have quality control. This, in essence, would be like legalizing moonshine. This will likely double the availability of marijuana and further encourage its use. Legalization poses great threat to safety to both the user and civilians, from drivers under the influence to people whose state of mind is altered. Over the past year in Loudoun, I have seen the tragic and accidental loss of life to a promising teenager and a non-provoked deadly assault on a law enforcement officer, largely due to the effects of THC. As for driving offenses, there is no such test, such as an alcohol breath test, to determine the level of intoxication a driver may be under the influence. Arrests are made based solely on the observations of the arresting officer and are challenged as being very subjective. This makes DUI enforcement and keeping our roads safe all the more difficult. Finally, I've seen from our direct engagement with the drug court the amount of resources required, law enforcement, judges, substance abuse professionals, prosecutors required to address this issue. While there is no silver bullet to stop the destruction of the drug causes, all avenues must be pursued to assist in addressing this issue. Legalizing marijuana will encourage even more drug use and stops any opportunity for preemptive engagement or early intervention, forcing taxpayers' resources to address the issue after the harm is caused. Thank you, and that's what I have to offer.
Thank you so much. And we move now to our final speaker, Kimberly from Parents Opposed to Pot.
Unmute myself. Hi there. Parents Opposed to Pot is a Virginia-based nonprofit. We've documented the legal rollout of marijuana around the country and the negative outcomes. We have built our online presence to 5 websites and social media channels. Our websites feature first-person horror stories from nearly 100 families around the U.S. Families are reporting dramatic personality changes, psychotic breaks, intractable mental illness, violent behavior, trauma to younger children, hopeless addiction, the burdensome cost of treatment, and even suicide. The problem: youth are getting access to high-potency products in legal states, even though it's illegal for them to buy it. PopPot is also tracking news reports of innocent baby, toddler, and child deaths involving a cannabis-impaired adult. Since 2012, when Colorado voters legalized, our national tragedy is that we have had at least 250 child abuse and neglect deaths. We can be a resource to journalists and citizens regarding the downsides of legalization. Our .org websites, PopPot, Moms Strong, Every Brain Matters, and Jennifer's Messengers and Stop Pot are full of links to government reports, science, and news stories. We do have medical experts, recovery experts, and parents willing to be interviewed. Thank you.
Thank you. I have one more person that was not on my itinerary list, unfortunately. If Colonel Katz, if you'd like to go ahead and speak a few words.
You have to unmute, Colonel Katz.
Thank you. One of the benefits of going last is a lot of the topics that needed to be covered have been covered. So I'm just going to touch on a couple of quick overview areas. And the first is that when a substance is legalized, it will remove the opportunity for those who are addicted to receive any type of support or resources from the criminal justice system. And that is something that in Chesterfield County, we have taken a tremendous amount of pride in helping people who have been struggling with addiction by providing resources through the criminal justice system that they would otherwise not be able to avail themselves of. Another topic that I wanted to touch on, and it's already been covered, really relates to traffic safety, the difficulty of traffic enforcement as it relates to impaired driving, and recognizing that in Colorado, for example, a study that was conducted by MAD in 2018 showed that in Colorado, where on average every 6.5 days someone would die as a result on the roadways of a marijuana-related impaired death, when recreational marijuana was passed, that number changed to every 2.5 days. And I want to tell you that as a law enforcement officer, as someone who shares the roadways with everyone on this call, the most difficult thing that we do as police officers is give a death notification to someone after a traffic crash. The recognition that there are those who are going to be profiting from sudden, violent, and random deaths on our roadway as a result of drug-impaired driving is unconscionable. And I think we really need to consider that we're removing resources from folks who are addicted, and we're making it more difficult for law enforcement to conduct thorough and just law enforcement of impaired driving on the roadways. That is a serious concern, and that is something I think we have to pause and look at how we go about doing that. And finally, I just want to touch quickly on the reality that marijuana is still a federal crime, and that may change. Nobody can really tell for sure, but when there are locations that have legalized marijuana and locations that do not, history shows us that there is a black market of drugs, and with that black market of drugs comes violence, comes shootings, and there are banks that will not work with people who are selling cannabis and marijuana, and there are niche industries for finance relating to that. With that comes robberies. And so that's very concerning. And finally, as it relates to drug enforcement, any experienced drug investigator will tell you that there are 3 things that come with anybody who is selling drugs, and that is money, guns, and drugs. There is a nexus and a violence to the drug sale and drug trade, and the use of tools that we have for such as canines used to detect illicit drugs. All of our canines that are used to detect illicit drugs, heroin, cocaine, marijuana, all of those dogs will not be able to be used on the larger concern relating to drug enforcement, and recognizing that 70,000 people a year die in this United States as a result of impairment. So that's something that I definitely want to make sure that we touch on those topics, and I appreciate your time. Thank you.
Thank you so much. I appreciate it. As I stated in the chat box, I said for members of the media, if you have any questions, please put your name and your outlet in the chat box and we will call on you just to prevent it going into a free-for-all of people asking questions. We have one question here from Alexis from WSLS. Says, what are your thoughts on the taxation on cannabis sales and how the funds could be going to the public schools? Would one of our Virginia coalitions like to answer that question? Or one of our substance abuse prevention members like to answer that?
Yes, this is Dr. Mary Crozier. So yeah, I reviewed that and I was troubled by that because it doesn't seem that enough funds are going to behavioral health and substance abuse prevention coalitions around the state. These community coalitions work closely with behavioral health and other of the state organizations like Virginia Foundation for Healthy Youth, etc. So it doesn't seem to me that enough money is targeted at the source. We are the experts and professionals in prevention, and there's also not enough funding going to treatment. We know that marijuana is causes psychological dependence and physiological addictions, as Dr. Lee talked about. So I think we should target those kind of funds. It also doesn't seem, it doesn't align with me. It's a false dichotomy to think that you can put money into these community equity funding, as is stated in this bill, yet you're trying to establish parity in communities with a substance that is toxic and risky to the individuals in that community. So I think by focusing funds on organizations and departments and coalitions that are already established makes a lot of sense. Thank you.
Thank you. Anyone else want to respond? About a minute.
I will. This is Regina Whitsett from SAFE. I was on the hearing this morning, and they're talking about a 30% tax by the time they do the sales tax and the taxes at the locality level. And what they're also talking about home grows, which they're giving people permission to grow up to 4 plants in their home. And what will happen, and I think some of the law enforcement officers talked about this, there will be a black market because the product will be cheaper on the black market rather than them paying the taxes. Yeah. And or they'll stay with the medical marijuana model, which are the pharmaceutical processors, which the pharmaceutical processors are going to be really damaged if the state moves forward with legalization, because every infrastructure that they've spent the last 3 years building is going to be taken over by big marijuana at the retail stores. So I think, while it sounds great that the taxation could go to the public schools, from what I understand, it was 3 to 4 year olds anyway. It wasn't the public schools. And just look at Colorado. There were promises that the money was going to go to the schools and or gambling, and the money with the lottery money was going to go to schools, and it just doesn't happen. And even if the money does go to schools and to treatment and to prevention, none of that money is going to make the consequences. What it's going to cost to pay for the unintended consequences is going to far outweigh any taxation money that any program may receive. Thank you.
I just want to add really quickly, we track what states that have legalized have done across the country, and no state as of yet has brought in even 1% of their state budget through taxation on marijuana. It's generally on average about 0.5% of the state budget that's brought in through those taxes. So we're talking about really in terms of the state budget, a small amount. And again, as was just mentioned, you have to take that against kind of a cost benefit analysis. So what are the costs of addiction, of substance abuse, of car accidents, and these things against that? Really, again, in the big picture, 0.5% on average state budget is what's brought in through revenue on taxing marijuana in states that have gone down this road.
Right, and if I will add just one thing, they said that legalization revenue in Colorado would go towards helping public schools. And I don't know if you noticed, but just last year, teachers in Colorado went on strike over low pay and low with funds. So clearly not helping in Colorado where it was supposed to. So a follow-up question here from Drew Wilder of NBC4. He says, there are mixed feelings in the marijuana subcommittee hearing this morning regarding ABC being the regulatory body. Aside from the concerns discussed, are there any issues with how the regulations are being proposed? Anyone on our call, feel free to jump in on this. Try to get 1-minute responses.
I can jump in here again. I've actually been to Washington State, and Washington State had a liquor control board, very similar to ABC, and then they went private, and then the Washington Liquor Control Board took over the cannabis industry, and they have the experience with regulating alcohol. They have the law enforcement capacity, they have the education component. So I think if they can get the staffing in place and set up a separate department that's solely focused on cannabis regulation and enforcement, it's a model that already works around alcohol. And I have mixed feelings about that because that can happen more quickly and versus setting up a separate agency. If they set up a separate agency, it's going to take longer and they're not going to have as much of the law enforcement education piece attached to it. I think it's going to be more focused on regulation and, minority input, which I think minority input is important, but like Will was saying, that's not happening even in Chicago. So I would say that the Virginia ABC already established system would be the best route to go, but I don't agree with moving forward in that direction at all anyway, because I oppose legalization.
Anyone else like to respond 1 minute? No? Okay. Anyone else, members of the press, have any questions? Again, put your name and outlet into the chat box. We'll give another minute or so here for someone to type. And again, as I said, we're recording this and we'll be distributing this along with a press release to the press following.
And just while we're waiting to see if any more questions pop in the box, I do want to add one more to that question from Alexis with WSLS. Another aspect that we need to consider and realize the realities of how things work is that our disadvantaged communities always suffer the brunt of addiction for profit and things like that. And we say we want to reinvest this in public schools and things like that. And I've said this many times as I'm talking about this issue, we say the same thing about alcohol, the lottery, and cigarettes, the taxes that are brought in from that. But if all of the money that was brought in from that could really change these schools, and the schools in communities like mine should be some of the best in a state. And the reality is that we see time and time again that there are still major inequalities in the school system, particularly when you live in a disadvantaged and a minority community. And we've not seen any change from the revenue brought in from alcohol, tobacco, or the lottery. We have no reason to believe that that's going to change just because it's cannabis.
Good. We'll give it 1 more minute for any questions, and if there are no more questions, we'll wrap this up. I'll go ahead and thank everyone on the coalition for coming here. We do have 1 more question here. This is from Mona with Politico. What do law enforcement representatives think about training more drug recognition experts for impaired driving? What are the pros, cons of emphasis on DREs for this issue? For that, I'll open it up to our members of law enforcement here to respond.
I think when you're talking about DUI enforcement, when you're talking about cannabis, there is no test for that. It's going to be very, very difficult to determine who is under the influence. It's all just by observation, and your way to articulate that there's no concrete way like you have the breathalyzers, the field breathalyzer test. So it does make it quite difficult for us to enforce that. And what you're seeing now is more people under the influence as a result of cannabis and other drugs than you're seeing with alcohol. So it is a problem across the board. I don't know how to address that any better other than that. That's why one of the reasons I would say that we're against it. It really does make the roads dangerous for us to drive on. You have other people out there that are under the influence, and it's just not a good formula for anybody's safety out there.
Thank you. Any other of our law enforcement representatives would like to chime in? If not, we'll go ahead and wrap this up. Again, thank you for all of our coalition members for taking the time out today. Thank you to members of the media for coming out and joining us. And again, I'll have a recording of this available as soon as I can to all of you. Thank you again, and have a great day. Bye-bye, everyone.